So students, in this lecture, we are going to study a drug that is epinephrine, which is also known as adrenaline. So students, this adrenaline is basically an emergency drug. Epinephrine is a natural neurotransmitter and commercially it is also available as drug. So basically this epinephrine is a catecholamine. What are catecholamines we will discuss in this lecture. So other examples of catecholamine other than epinephrine are norepinephrine, dopamine and dobutamine. So among these drugs, among these substances, epinephrine, norepinephrine and dopamine are the naturally occurring neurotransmitters, while this dobutamine is actually a synthetic compound. Now, coming towards that, what is catecholamine? Catecholamine is basically a monoamine neurotransmitter. So, now what are catecholamines? Catecholamines are the structures or the organic compounds which contain a benzene ring. This is a benzene ring with two side chain, that is with two side hydroxyl groups. So, in catecholamines, we have a catechol ring, that is a benzene ring with two side hydroxyl groups. And additionally, we have an amine group. This is the amine group. So in this case, we have a side chain amine. So now what is definition of catecholamine? Catecholamines are the monoamines which contains the catechol ring with a side chain amine. Now what is catechol ring? Catechol ring is basically a benzene which contains the two side hydroxyl groups. Now coming towards the epinephrine again. So basically students, adrenal medulla contains or stores the epinephrine. Adrenal medulla has norepinephrine. Here this is the structure of norepinephrine in the left side in the gray section. This norepinephrine contains an H group. So while in case of epinephrine, we have methyl group. So norepinephrine contains the H group, while the epinephrine contains the methyl group. So in adrenal medulla, we have both norepinephrine and epinephrine. In adrenal medulla, basically, this norepinephrine is methylated to the epinephrine. This epinephrine is converted into its form. It is the conversion of norepinephrine. So in adrenal medulla, norepinephrine after methylation is converted into epinephrine. That is by the addition of methyl group to the norepinephrine, we have epinephrine. So now both of these epinephrine and norepinephrine are stored in these cells, which are the chromatin cells, which are present in adrenal medulla. Now, whenever there is stimulation of the adrenal medulla, there will be release of 80% epinephrine, which is known as adrenaline, and 20% of the norepinephrine. So we know that this epinephrine is basically a non-selective drug. This is a non-selective neurotransmitter. It has ability to interact with both the alpha receptors and the beta receptors. At lower doses, beta effects are more prominent, that is the vasodilatory effects. At higher doses, we have alpha effect, we have vasoconstriction effects. So coming towards the pharmacological effects of epinephrine, firstly, we are going to discuss cardiovascular effects. So, mainly, this epinephrine is inotropic and chronotropic. Inotropic means it increases the force of contraction of the heart. Chronotropic means it's a positive chronotropic, it increases the heart rate. So because of its chronotropic and the inotropic properties, this epinephrine increases the cardiac output. As a result, there will be increase in the blood pressure. Now, how this epinephrine causes hypertension? What is the underlying mechanism? What is the scientific reason behind it? So as we know, students, that our kidney contains the beta-1 receptors. Whenever there is stimulation of beta-1 receptors by epinephrine, there will be release of renin. So what this renin will do, we already know that our body contains angiotensinogen, which is a precursor protein. Now this renin will cleave or break down this angiotensinogen into angiotensin 1. Now the next step is conversion of this angiotensin 1 into angiotensin 2. Now how this one angiotensin 1 will be converted into angiotensin 2? That will be with the help of an enzyme, that is ACE, that is angiotensin converting enzyme. So this converting enzyme will convert this angiotensin 1 into angiotensin 2. So as we know that our arteries contains the angiotensin 2 receptors. Now this formed angiotensin 2 will interact with the angiotensin 2 receptors. As a result, there will be arterial constriction. As a result, there will be hypertension. So, basically, students, this epinephrine is a non-selective neurotransmitter. This is a non-selective drug. It produces its action on both alpha receptors and the beta receptors. So in this regard, we will have a mixed effect regarding blood pressure. Due to its alpha effects, that is arterial constriction, there will be effect that will be different from the beta stimulation. Beta stimulation will result in dilation of the vessels. Due to alpha effect, there will be constriction of the arterioles of the skin, mucous membrane, and the viscera. While due to beta 2 effect, there will be vessel dilation, dilation of the vessels which are going towards the liver and the skeletal muscles. Thirdly, renal blood flow is decreased. So because of all these three effects, there will be increase in systolic blood pressure, while there will be slight decrease in diastolic blood pressure. So this diagram is actually representing that what happens in case of epinephrine. Epinephrine decreases the peripheral resistance. So while there will be increase in systolic blood pressure, there will be slight decrease in diastolic blood pressure. So this increase in systolic pressure and decrease in diastolic pressure is due to the combinant effect. This is due to the activation of both alpha and the beta receptors. So what are the effects of epinephrine on respiration, on your bronchioles? So due to activation of the beta 2 receptors by epinephrine, there will be bronchodilation. This is the first effect. Secondly, this epinephrine has ability to inhibit the release of allergens, allergy mediators. So we know that we have mast cell, and these mast cells contains the histamine, which is the allergy mediator. So this epinephrine has ability to inhibit the release of this histamine from the mast cell. So this is also beneficial in case of asthmatic patients. Now coming towards the hyperglycemic effects. So epinephrine has significant hyperglycemic effect because it increases glycogenolysis, that is the breakdown of glycogen into glucose due to beta 2 effect. Secondly, it has ability to increase the release of glucagon. This is also because of beta 2 effect. Thirdly, it decreases the release of insulin due to activation of alpha 2 receptors. So all these three factors simultaneously causes hyperglycemia. Now coming toward lipolysis. So this epinephrine has ability to initiate, to stimulate lipolysis. How? Because of beta 3 receptors which are present on the adipose tissues. So whenever there is stimulation of beta receptors on adipose tissue, there will be activation of the enzyme, that is adenyl cyclase. As a result, there will be increase in cyclic AMP. There will be stimulation of the enzyme, that is lipase, with the cyclic AMP. As a result, there will be hydrolysis of the breakdown of this triacylglycerol into glycerol and free fatty acids. So this was all about lipolysis. Now, why this epinephrine is called as an emergency drug? Because of its therapeutic uses. Now coming towards the therapeutic uses of epinephrine. First use is related to your bronchioles. This is the drug which is very effective in case of bronchospasm, in case of bronchoconstriction. So these effects are because of the beta receptors. So this is the drug of choice also in case of anaphylactic shock. In anaphylactic shock, there is decrease in blood pressure, there is decrease in blood supply or oxygen to the cells or the muscles. We have breathing problem in case of anaphylactic shock. So in both of these cases, we prefer epinephrine. So this epinephrine is a drug of choice in case of anaphylactic shock because of its beta effects. But particularly for the asthma, we have selective drugs in the market. For example, we have beta 2 selective drug, that is albuterol, which is the preferred drug for the chronic treatment of asthma. Why? Because it is a specific drug which will specifically act on your beta 2 receptor without affecting your heart. Secondly, this drug has longer duration of action. Now, I have already discussed that this epinephrine is a drug of choice for the anaphylactic shock. This is the drug of choice for type 1 hypersensitivity reaction. So we have different types of hypersensitivity reaction. In this case, the type 1 hypersensitivity reaction we already know is a type of reaction, is a type of hypersensitivity reaction, which is immunoglobulin E mediated reaction. that involves IgE. So in it, there is IgE mediated release of antibodies against the antigens. So in these cases, epinephrine is a preferred drug. Why we are using this epinephrine in anaphylactic shock? In anaphylactic shock, there is drop in blood pressure. There is decreased supply of blood and oxygen to the tissues and the organs. We have breathing problems. So in this case, why we are using epinephrine? So what epinephrine will do, because of the activation of beta-1 receptor, it will constrict the vessels. As a result, there will be increase in blood pressure. So secondly, we know we have breathing issues in case of anaphylactic shock. So in case of beta-2 receptor activation by the epinephrine, there will be the relaxation of the bronchial muscles. So this is also beneficial for the patient who has suffered from anaphylactic shock. Now coming towards the cardiac arrest. This is a drug of choice which restores the cardiac rhythm because of its receptor activity. Now coming towards the anesthetic uses, this is the drug which we use in combination with anesthetics. You can use this epinephrine with local anesthetic for injections, for the topical administrations. This local anesthetic solution contains lower concentration of epinephrine. What will epinephrine do in this case? This will increase the duration of the local anesthetics. Why it will increase the duration of the local anesthetics? By producing vasoconstriction at the site of injection. So what will happen due to vasoconstriction? Your local anesthetic will stay at the injection site for the longer period of time. So this epinephrine can also be used topically. Why this can be used topically? Because it has ability to constrict the mucous membrane, so it can be used to control the oozing of the capillary blood. Now coming towards the pharmacokinetics of epinephrine. This drug has rapid onset of action. It has brief duration of action because of degradation. You can give this drug intramuscularly. You can give in emergency condition. We prefer to give it IV, that is intravenously, for rapid onset of action. You can give this drug subcutaneously. You can give this drug by endotracheal tube. You can give this by inhalation. So we have different routes of administration for epinephrine, but in the case of emergency situations, we will prefer IV route. Secondly, how this drug is readily degraded, particularly in oral cases, because of the enzymes which are present in your intestine. So this drug can be metabolized by MAO, that is monoamine oxidases, and catechol O methyl transferases. So what these will do, these will metabolize epinephrine into metabolites which are excreted in the urine. So what are these metabolites? These are metnephrine and vinyl mandelic acid. So coming towards the adverse effects of epinephrine, we have CNS related effects that include anxiety, fear, tension, headache, and tremor. Then we have cardiac effects. For example, if your patient is already taking digoxin, which is used for heart failure, side effect of digoxin is arrhythmia. So if the patient is taking digoxin, he may also possibly be suffering from arrhythmia, and the epinephrine also has ability to cause arrhythmia. So in this case, this epinephrine will trigger the cardiac arrhythmias. Thirdly, this epinephrine has ability to induce pulmonary edema, that is excess fluid in the lungs. So what happens in case of patients who are suffering from hyperthyroidism? As we know, in case of hyperthyroidism, your thyroid glands produce too much of the hormone, that is the thyroxine. Secondly, there will be increase in the blood pressure. And this in the case of thyroidism, there is increased production of adrenergic receptors. So patient with hyperthyroidism is already suffering from increase in blood pressure. If you are giving epinephrine to such patients, now what epinephrine will do, it will enhance the cardiovascular actions. So in this case, there will be interaction between the because of epinephrine, interaction of epinephrine with digoxin, as we have studied in our previous slide. Then in case of patients suffering from hyperthyroidism, this epinephrine has ability to exaggerate the cardiovascular effects. So in the case of inhalation anesthetics sensitize the heart to the effect of epinephrine, which will lead towards the tachycardia. So what happens in patients suffering from diabetes? As we know that epinephrine increases the release of glucose, it increases the level of glucose. So in diabetic patient, the dose of insulin must be increased. So students, this was all about the epinephrine. It was all about the clinical uses of epinephrine and pharmacokinetics of epinephrine.